Welcome to another segment of Politics Done Right. I'm here with Dr. Shannon Sovndal, medical doctor, and we are going to discuss the issue with COVID 19 and opening up the country. Not like the country was ever closed, it was closed for everyone else except the essential workers. Well, turns out that Dr. Sovndal is an essential worker. Dr. Sovndal, welcome aboard Politics Done Right. How are you doing today?
Hey, thanks for having me. I'm doing well, thanks.
Well, look, let me tell you, first of all, I just want to hear your general impressions about the president deciding to sort of force feed to the states that we need to get people out there going to get this economy going. What's your general thoughts on that?
Well, I mean, I think we're playing with two parts of a puzzle, right? The first part is we're trying to protect the public from COVID-19. We're trying to flatten the curve, as you've heard ad nauseum. We're trying to slow the spread, but at the same time, we do need to, have the country functioning. We need our economy functioning. If we don't have that functioning, then there's certainly ramifications from that, and those could be health ramifications as well. So we have to look at both sides and kind of cautiously move forward. But at some point, we do have to move forward.
Now, I know that we have to move forward, but in order to move forward, there are a whole lot of steps that we need to take before we can actually do that. And one has to decide if these are state-based methods or is it going to be federal methods, et cetera. What are your thoughts? First of all, what would be these steps that one would have to take to do that?
Yeah, if it was up to me, I think that we need to have a strong leadership present, and that's from the top on down, meaning guiding us on what's the plan and how are we going to do this. That needs to revolve around extensive testing and retesting, meaning we need a lot of tests, way more tests than we have available. We're talking millions of tests a week that we're doing to order to get a real idea of what this virus is doing, how effective it is, where we stand in the response curve. All of those things, we need to base it on data, and we need to base that data on testing. And the frustrating piece for a lot of people is the models, and everyone's saying the models are wrong. This one overestimated, this one underestimated. The models are actually good. They're good pieces of equipment and good tools. The problem is the data numbers that we're putting in. That's where we're lacking. And the only way that we can get those numbers is to really do massive testing and get an idea of where this virus sits.
Yeah, I think a lot of people don't really understand models. Models depend on the inputs that you put into it, and not only that, but it can change if the inputs actually change. In other words, we all stayed home for a while, and by staying home, we mitigated the infection rates, et cetera, et cetera. Now, what's your thoughts on how we handled this in the first place? I know you're aware that this virus was known back in November, if not a bit before.
Yeah, I mean, I think, in hindsight, it's always easy to look at things because you don't know exactly the way they're going to pan out. You can look at the models, like we said, some, overestimate the fatality rate, others underestimate it, and we just don't know. I think that from a standpoint of as a physician, it is good to be conservative and safe, and better safe than sorry. I think it's very appropriate early on to take a time out, essentially say, hey, we need to have everyone stay at home so that we can figure out what's happening with this virus. If we don't know those numbers, that was really the time to figure it out, was to say, let's do a lot of testing right now, early on, and then we can get an idea of how it's going to shape out as we move forward.
No, it's not first of all, a lot of people say it's not the good time to start assigning blame. To some extent, I agree. From a political perspective, however, I understand that if one doesn't start to do it at just the right time, mistakes are one goes ahead and repeats the same mistakes over and over again. What would be your advice as far as let's go ahead and start looking into the past? In what manner would you do that?
I mean, I think that you always want to know when data was available, how that data was delivered, who was delivering the data, meaning up the chain of command through not just the federal government, but in the states as well. And we even deal with that, at a hospital level. So it's kind of at all levels, you need to say, hey, when did they have information and how was that information acted upon?
Now, you are a board certified emergency medicine doctor, which means you're out there. You are in the middle of the field, in the middle of the fire. Why don't you tell me a little bit about some of the experiences that you saw? I want people to understand that this is not some sort of an antiseptic virus or an antiseptic being. What I'm seeing around a lot of the world who haven't been hit yet sort of need to know what doctors like yourself and others in the Midwest, others in the middle of the country are eventually going to be walking onto.
Yeah, well, I mean, we can start by, with our previous comments that we don't necessarily know the numbers of this virus, meaning we don't know the denominator, we don't know mortality rate, we don't know all these things. But we do know what the hospitals were experiencing in New York City. We do know what really hard hit areas we're experiencing. And that's really what we have to base our moving forward on, is to say, yeah, I don't have the specifics, but I do know that we don't want to be another New York City in a different, geographic location. And so really from a frontline standpoint, early on, we were worried about a couple things. First is, how do we protect the staff? So how do we make sure that those providing care have the appropriate equipment on? And then how do we interact with, the patients that are coming in? The tricky part of the emergency department is it's always a bit of a dangerous place, meaning we don't know who's walking through the door, right? And we can get exposures of different diseases. We can catch hepatitis, HIV. We can have a combative patient that, attacks us. People can even have tuberculosis and things like that. So we're kind of at baseline ready to deal with some of those threats. The problem with this, in part, is you didn't always know who had it, and we don't know how prevalent the disease process was, meaning that I could have someone check into the ER for one condition, and it turns out that they might have COVID. And a great example of that is, I had a patient that had kidney stones. He came to the ER for kidney stones, and I did an imaging study to look for his kidney stones. And on that imaging study, we saw that he had ground glass appearance, both of his lower lobes and his lung, which is
Oh my
really
God,
kind of
yes.
prevalent in COVID patients, right? And so
Yes.
this patient was not complaining of COVID symptoms. This patient was complaining of a kidney stone, which he had. And so that makes it difficult from a frontline standpoint, meaning very early on, we had to assume everyone had the disease. So that's why you see providers with their PPE on. And, essentially when you put that PPE on, you wear it for the whole shift. I put it on and I don't take it off. The risk is putting your hands to your face, moving that equipment back and forth. And so I really want to limit that. So it's kind of, having strong vigilance that everyone has the disease in the way that we approach the patient, and then being really careful with your protective gear.
Now, tell us a little bit about transmission, because now that you mentioned the protective gear that you have, the average person that's doing their exercise, even though they're home, they're running on the outside, they're doing a whole lot of things. How much more safe do we need to be? Can we run on the outside? Can we go to the grocery stores? Give us a lowdown on that.
Yeah, so again, there was a lot of talk early on. This is a droplet-borne virus, and what that means is it's droplet particles. It's particles that get on surfaces, and then we touch those surfaces, and we touch our mouth, our nose, or our eyes, and that's how we get it. It can be put into the air. For example, if someone sneezes, if I sneeze in the room and you're in that room, I throw little particles in the air. That doesn't mean it's an airborne virus.
Mm-hmm.
That just means those particles were spewed in the air by someone sneezing. And really what we're trying to do with social distancing and masks is we're trying to get a herd protection from this. If we stay 6 feet apart from each other, if we wear a mask when we're out in public, that means that whenever I sneeze, I'm kind of blunting that spread of the droplets. And if everyone does that, then we really can kind of get a handle on it. And my thoughts on this as we move forward is I would like to start opening things up, but I would also like to do it very cautiously and reasonably. And that, as we said, involves a lot of testing, but it also involves continued social distancing and wearing a mask. That would be my recommendation. Until we know exactly what's going on, let's just be safe. That doesn't mean that you can't go out. It just means I'm going to attempt to stay, away from people. We're not going to be in large groups hugging and doing our normal greetings. You wear a mask when you're out in public. If you need to, even go and get some food somewhere where you can move away from someone and wash your hands and take your mask off, eat your food, but then put your mask back on. And that will get us moving back towards normalcy. But it will also do it in a conservative way until we know for sure, where we're sitting with this virus.
One last question about COVID-19. I understand that they're finding out that it's expressing itself in a lot of different ways. Now, I just read that now children may be getting some sort of a shock syndrome, inflammation type syndrome from it. I had a cousin who's a detective in New York who got it, and it turned out he got some blood clots and got a stroke. But he's getting much better from the stroke. And of course, we know the pulmonary destruction that you have. What's the for those who make it through, which is most people do. What's the condition that their bodies are left in? Pre-existing conditions, which would later affect their insurability. What are we looking at?
Well, I mean, all this is really interesting items, especially from a doctor standpoint. But again, it goes back to the needing to know how prevalent the disease is and how many people have this. And the reason why is because if we have a very prevalent disease and we say everyone, has COVID, and then we look at patients who have strokes or complications, that could be just because a large number of people have the disease, and ultimately some of those people are going to have strokes and other problems. We also need to look at it from a standpoint, well, if I know the number, then I can say for certain that strokes are much higher in patients that had COVID, and I can start to identify those problems. Again, when you go back, I find that all those things are very interesting, but I don't have a scientific basis yet to tell you what the risk is of having blood clots or strokes or heart problems after the COVID, because we just don't know the numbers yet. Certainly, all of that needs to be looked into, and I'm anxiously waiting to get some data so that we can look at those things and get a clearer picture as to what the risks of various disease entities are once you have COVID-19.
Dr. Sandoval, I respect that. I respect anybody who's able to say we don't quite know. So I do appreciate that. Now, there are two reasons I wanted to bring you here, specifically to talk about opening up the countries and the risks that we're taking. But the other issue is that I understand that you did this. You wrote a book called Fragile. Tell me a little bit about this book. It seems quite interesting from what I haven't read it, but I saw it on the website and said, it seems like a pretty personal book. Talk to me about it.
Yeah, so it's called Fragile: Beauty and Chaos, Grace and Tragedy, and the Hope That Lives in Between. And when you write a book, it starts years ago. I mean, I started writing this book 8 or 9 years ago, and then you decide to publish it about a year ago, and you get the whole process going. And then it turns out that you're releasing the book in the middle of a pandemic, and it is odd and crazy, the timing. I think it's odd and crazy the fact that I'm wearing a mask on the cover of the book and we're in the middle of a pandemic here. But really, it just drives the point home of the book, the fact that we're in a pandemic. And really what that is, life is fragile. At any moment, you can lose everything that you have. Everything that you thought was normal can be turned on its head in an instant, right? And we know that from having a heart attack or having a car accident. And now we all know it, not just you and me and not just the United States, but the whole world knows it because we have a pandemic that just turned everything on its head. And really what we're talking about is having a realization that life is fragile, and oftentimes it's beyond your control. That might seem very scary and daunting, but really what fragile is resiliency. It's about how do you look at how that affects you, the fact that the world is fragile and these things can happen, but how does that open up your life? And certainly from my role as a doctor over the last 20 years, it's definitely changed the way my outlook is on life for the positive, meaning I feel so much more deeply when I come home and hug my kids, or when I get to go on a dance with my wife or a date or whatever the case is, right? I get to have this emotional feel because I've seen the other side. I've seen how devastating things can be. So I get to live in the moment. When I have a good moment, man, I really embrace that for all that it is. And right now we call this the great pause, right? The pandemic's this great pause that we have. And what an opportunity for us to really evaluate what's valuable in our lives and what's important. And stop asking all the whys. Why does this happen? Why is there a heart attack? Why is there a pandemic? That's the wrong question, right? We need to ask who's in our life? Who are we trying to connect with? And really, it's the bigger picture of the why. Like, what is my why in living?
Let me tell you, Doc, that's pretty wise. I mean, as it turns out, I've been talking to a whole lot of people about what this really means, and it's amazing how it's really connected a whole lot of people. People see that they can do with a lot less. People see that, I mean, there's a whole lot of new things people are discovering now, which makes it that we will never be the same again. And that new normal doesn't mean a worse or a better normal, but just a new normal. So I enjoy that. Give me some a closing statement before we go. Before that. Tell me first of all, how are you holding up with all the pain that you're seeing in these emergency rooms, and how are the nurses and the janitors? And because people have to, what I tell people all the time when we talk about essential workers, you're essential. You're a doctor. You're saving people. Your nurses are essential. They're saving people. Those janitors that are cleaning those floors are essential. Those secretaries and everybody else that doing that work, they're essential, and their work is valuable. We couldn't do it without them. Tell me how you see them holding up in these areas that you're at.
Well, absolutely. I fully agree with you. My hat off to everybody who's a first responder and on the front lines working. And that's everybody that makes the system work on the front lines. We couldn't do it, like you said, without the janitor, the EVS people, the people at the front desk. We need all of those people to make this function. And you know what I've been very impressed with is that they all are showing up to work. You know, we don't have mass call outs. We have people stepping into the fire saying, I'm going to go to work. I'm going to take care of everybody. And it gives me a real sense of pride that I'm part of that team overall, that they're doing that. And we have a thing in our neighborhood that is the 8 o'clock howl. So people howl for first responders at 8 o'clock.
Nice.
And it's moving. I go outside and I hear neighbors, you know, howling like wolves outside, you know, giving their support to first responders. And I think that, you know, it is hard work. It's hard to be in the PPE. It's stressful because you're worried that you could get sick. You're worried you can bring it home to your family. You know, I'm exhausted when I come home, really just from wearing the equipment and being worried about it. And I do have concerns that, you know, 6 months from now, the stress is going to catch up to people, right? We're really good in the moment. We're good fighting through the moment, but there is some cost, and you're going to have to deal with all this stress and pressure that we were feeling. And, you know, I just would really push out there to keep offering your support to the first responders, talk to them. And if you are a first responder, hospital worker, you know, talk to each other about it. Talk about the stress you're having, how you're, you know, feeling stressed at home, if you're arguing with your wife or whatever the case is, right? This is real life stress that's on you. And the sooner we can, you know, start opening up about it and addressing it, I think the better off we'll be.
Dr. Shannon Sovndal, MD, thank you so kindly for spending this time with Politics Done Right. We didn't really go into politics, but I think right now this is much more important. You have a wonderful day.
Yeah, thanks for having me.
I'm Egberto Willies, host of Politics Done Right, an independent news program. I post several news videos of interest every day. I ask you so kindly to subscribe to my channel, and please leave me some comments. Thank you very much.